Post-traumatic stress disorder, PTSD, is pretty common. Many people will be familiar with PTSD, but what is PTSD all about? It is a mental or psychiatric disorder or a condition that has been created by an exposure to a scary, life-threatening, terrifying situation, and that could be directly or indirectly. So certain changes or effects are now affecting our psyche, affecting our cognition and even somatic and affective or the mind generally, and changing our behavior, and all is due to the fact that we have been exposed to a traumatic condition, and the effect of that traumatic condition is what we are now suffering again as PTSD. Here is the first note at a glance to give you the idea of what you're going to find when you are listening to this presentation from beginning to the end. I've just gone through the definition on the previous slide. PTSD can happen to anyone, and we will even make the diagnosis once the individual is greater than 6 years. So imagine, from 6 years till, who knows, so how old the individual presenting may be. Many have it, so forget about the social stigma. Many have PTSD, so it's not only you. So why won't you get up and get out and seek help right now? You are not the only one, please. Don't hurt yourself. Many have it. You don't have to be the direct victim of the trauma. Yeah, you may not be. You might be a relation, you might have witnessed it, you might be working as an investigator, you might be a police officer. No, you don't have to be a military personnel before you have PTSD. No. You can even be a journalist, just telling the whole world about what has happened, or you're a journalist, covering war. Right. So you don't have to be the victim directly before you can have PTSD. The timing is the issue between PTSD and acute stress disorder. As we continue in this presentation, I will define that repeatedly, but I won't be lazy to skip that right now. So let me quickly touch on that acute stress disorder is what you're going to experience as signs or symptoms immediately you're exposed to a traumatic condition. And it is still acute stress disorder if you are within the first day and 30th day post-traumatic exposure. But once you pass the first month, then you are becoming a PTSD sufferer. Meeting point between PTSD and ASD is stress disorder. Both will be associated with stress, okay? Then, like I said, it can happen to anyone, and many have it. So please, forget the fact that you want to keep it to yourself. That's what I want to gain by this presentation. I want you to know your risk factors and everything, and then when you are exposed and you are passing through certain symptoms, get up and seek help. I don't want you to die. I don't want you to kill yourself, and I don't want you to kill someone else. The difference between ASD and PTSD is what? It's just by timing, the time, okay? It's the time. The first 30 days is ASD. After that is PTSD, okay? And of course, there are subtypes. I will get into that in a bit. Now, who could be screened for PTSD? When we get to diagnosis, you get full info, because it's not everyone who comes to the clinic that will be screened for PTSD. Certain people working in particular occupation, somebody presenting with certain signs and symptoms for the first time in their life, some people with some other conditions, of people with clusters of PTSD, 4 key symptoms of PTSD, we'll screen them. Okay, then we'll check out the risk factors. If I were you, I'll go straight to risk factors, find out if I belong or not. Then can you avoid it? Can you avoid the complications? Don't worry, you'll get to that section and you will understand everything there. Signs and symptoms have been clearly stated right here. The diagnosis is fully explained here, including DSM-5, and then who needs treatment, and of course, what is the mode? How are we going to treat this person? I know many people won't listen to that. They will leave that to medical students, nurses, and doctors. What are the possible warnings that we have to watch out for and take care of? I have taken the time to explain fully here. And about the prognosis, one third of what? And what's going to happen? Is there any cure? If I tell you right now, you may end listening to this presentation, and I'm not going to tell you, listen, go, and the prognosis is even at the last. So you get that. By definition, acute stress disorder is those signs or symptoms that will follow your exposure to a traumatic event within day 1 post-trauma till day 30 post-trauma. So 1 month, within 1 month post-exposure to traumatic events, the signs and symptoms will all be defined under acute stress disorder. But once it is greater than 30 days, you are getting to the 2nd month, the 3rd month, it is post-traumatic stress disorder. So it's a factor of the time. The meeting point between post-traumatic stress disorder and acute stress disorder is SD, stress disorder. So one is acute, the other one is post-traumatic. Both is telling us that this individual has passed through a stressful condition, and he or she is now having the following signs and symptoms based on that. It can happen to anyone. We will make the diagnosis of PTSD in anyone greater than 6 years presenting with signs and symptoms. In fact, when you reach signs and symptoms, I have clearly stated what I'm going to pick in anyone greater than 6 years, 8 years, 12 to 8 years, and older, differently. For example, bedwetting that has not been there in this girl or boy after completely being dried at age 2, now at age 6.5, 7, it's now bedwetting. Please ask more questions. Something is going on. You may not have to be directly involved. You don't have to be. Yes, like I said, you don't have to be directly involved. You could have just witnessed it. You are not a victim, but you just witnessed what happened to someone else. That could give you PTSD for life. Then, it has not happened to you, you didn't witness it, but it has happened to a close person to you. Like a close one called you and related what happened to him or her, and you believe it, that could sink into your own brain. Or your close person is dead. Or your close person has an injury that's so severe, maybe they become paralyzed, anything horrible that is so scary, not happening to you, but happening to someone close to you. Then you can develop PTSD. Or not even any of these things I've just mentioned, but you just have full knowledge of the traumatic, case, like you're just doing your work, you're a police officer. You have been called to a house where someone who has committed crime happened to be the same person who has called 911 to the same house, and on getting there, you could see another human being in pool of blood, and you've never seen that before. Or you're an investigator, you are no forensic expert, no medical examiner. You don't have to be a military personnel, driving the machine gun and on war front before you have PTSD. No, then be a journalist and have PTSD. Yeah, all you need is just the exposure directly or indirectly. You're having the knowledge of it. You create the scene, you create everything. You investigate the scene, you see the exhibit, even court clerk who will put all these things together, who will be typing, and all these things could constitute the source or the triggers of PTSD. Okay, like I've said earlier, PTSD and ASD are close, but the difference will be time. And how? Well, I think this will be a repetition, but I'll go straight to that in seconds. ASD, within the 1 to 30, it is still ASD. But greater than 30 will be PTSD. So PTSD will be diagnosed if signs and symptoms are occurring after 1 to 3 months. But there is delay PTSD that will occur in about 25% of people with PTSD or a quarter of people with PTSD. And that will occur after 6 months. Okay, here is the question. Can you avoid it? Can you avoid PTSD, or can you avoid the complications of PTSD? In other words, is it avoidable? Well, let's see if we can easily answer that. If I were to be in your shoes, listening to this presentation for the first time, the first thing I'm going to do is check the risk factors. I'll go there right now, okay? And once exposed to a traumatic condition, I will seek help immediately. Although PTSD will not be diagnosed until after experiencing the signs and symptoms for a month, because before then, it is acute stress disorder. But since I'm aware right now, I won't wait till 2 months after before seeking help. Tell someone you trust you are running away from social stigma. Tell someone you can trust. See a physician as quickly as possible. Then try to build a kind of a shock absorber or a coping mechanism in your system, in your brain, and in your life. If that is not working, then get up fast. Find a physician, find someone you can trust who can connect you with a psychiatrist who will help you. Join the team of strong or resilient men and women in the world who will not be deterred by the trauma they've experienced, but will continue to forge ahead in life. Avoid what is avoidable, but don't let it become what would drive your entire life. Okay? You are welcome to my channel. Thanks for listening. Please remember to subscribe if you haven't. But if you have subscribed and you are visiting again, I'm saying a big thank you. Today is about post-traumatic stress disorder, but I'll be limiting myself to risk factors on. Without further ado, let's go. Now, the risk factors. Almost anything happening in the medical field in this generation could be traced to the gene. So, hereditary or genetic factor will play a strong role here. Then, female gender. Some authorities will put the ratio of PTSD in female to male as 4:1 respectively, while others will put the ratio in female to male as 2:1. Either way, it is more in female compared to male. And some give us explanation that it is mostly due to cyclical estrogen that has made the frequency in women to be higher than in men. Then, higher level of stress hormones. Well, once there is PTSD, we expect stress hormones to be high, fight or flight, and that is about epinephrine, that is known as adrenaline, or norepinephrine, that is known as noradrenaline. Cortisol, growth hormone, and glucagon are all stress hormones. So, hypothalamic pituitary adrenal axis is greatly involved here. And that will be addressing corticotrophin releasing hormone from the hypothalamus, adrenocorticotropic hormone from the pituitary gland, and of course, cortisol, adrenaline, or epinephrine from the adrenal gland. When it comes to other risk factors like the brain itself, everything happening is happening within the brain. The processing of the context will involve the hippocampus, prefrontal cortex, and amygdala. Alteration in the normal impulse that traverses these or the activities there will lead to a kind of fixed condition that will put the experience there as if it is still happening when in the recent is no more there. In psychiatric disorders, there are some associated psychiatric problems that could worsen PTSD. So PTSD will be associated with anxiety. For example, generalized anxiety disorder with panic attack and some specific phobias like agoraphobia and just anything that has happened before, then you develop kind of fear that you don't want to go near it again. Then you have phobia as per that very event. And then depression is not far away from PTSD. As a matter of fact, by the time we are dealing with symptoms, you understand better that from there it could lead to suicide. That is why many with PTSD who are not being helped properly or who are shying away from expressing themselves and they are not seeking help may actually commit suicide. Then, drug abuse, drug use. As a matter of fact, we need to rule out all these things before we make the definitive diagnosis of PTSD. And of course, obsessive compulsive disorder and somatization. Then, there is this entity known as acute stress disorder. That is what we will all experience in the first month when we're subjected to traumatic event. Many people will get out of it that time, but majority will not get out of it and they come down with PTSD. I'm not going to take your time explaining that in details here because there's a separate presentation for that. Then adjustment disorder could be the problem and could even be complex PTSD, in which case it's going to be associated with repeated events. PTSD here is associated with one event in many of the PTSDs. But when it is complex PTSD, then there's a repeated event. The defining clinical feature with complex PTSD is that it is with dissociation and the perception of self in a negative term, like having no negative self-image is found in complex PTSD. Emptiness or lack of social support, that's a big risk factor. I just gave this example here, that's what I could pick with the Microsoft 360. So in this case, like somebody, you're married, you have kids, the kids are grown, they've finished schooling, they're out on their own, and you're by yourself, maybe through divorce or death, the spouse is not there, or you are not even married, there's no job, you don't have friends around, no social support. All this could worsen PTSD in anyone who will be subjected to traumatic events. Social stressors like divorce. I've just alluded to that while explaining emptiness condition. Then a repeat episodes or similar events reoccurring. Some people can cope with one event as acute stress disorder and get out of it. But when it is repeating itself, then the memory of what happened the first time will just flash back. And then now it's repeating itself. Even another time when it's not there, the brain will play the video back to them that you're about to have accident again. Then they are now in PTSD full blown. Then medically related impairment. In this case, the medically related impairment means that you are physically impaired and then you are exposed to traumatic events again. That can lead to a palpable fear, or you begin to figure it out even before it occurs that now that I'm not capable of running, what if someone is shooting nearby, or what if there's fire outbreak, or even arson, maybe somebody's setting the house on fire, how will I get out? How will I escape? You understand what I'm trying to say? So that alone, you begin to process what is not there. You begin to develop fear in what is not even there at all. Double insult. How do you mean by double insult? Yeah, someone has been exposed to a traumatic event like road traffic accident, then the same individual is being subjected to emotional insult or physical abuse. So trying to get out of one, another traumatic event has occurred. So that could tilt the individual to PTSD. I don't want to delve too much into race because PTSD is going to occur in any race, any age, all over the world. Though it's worse in some people, but I don't want anybody to feel bad. Let us just take it that PTSD will occur in anyone, anywhere, at any age, except in infants and not too young kids. Then low level of education could probably worsen the situation because like you are listening to this presentation right now, if you listen to the full presentation where every aspect is being covered, you understand that I would have explained how you can avoid PTSD, what you can do, how to seek help quickly. But some don't even have internet to listen to this, so that could affect them negatively in the sense that they keep brooding and brooding on the negative events in their life. Is flashing back, it's affecting the way they are thinking, it's affecting their occupation, their relationship with people around them. Now, low socioeconomic status and age. When it comes to age, it is worse when the traumatic events occurs in childhood, particularly at the age when a child can remember the events. If it occurs in infants, for example, who will not understand anything, but like even those kids in some schools where mass shootings took place in recent years, though they were in elementary schools, now they are growing and growing without memory. That is pretty bad. It's not good at any age, but imagine somebody passing through PTSD from childhood, taking PTSD from elementary school to high school, then to the university, and to marriage, and to work. Is going to shape, redefine them completely. They are going to form a separate personality entirely. And of course, the nature of the trauma. We all pass through different things, different times. People bear it differently also. Religious belief. Some believe that whatever happens is natural, is your destiny, is what superior being has planned for you. So take it like that. Even when they have children and the children should die, they are going to say, some will say, the superior being gave you and the superior being has taken, so you bless the superior being and then you continue to live your life. They won't want to brood on it, and even when it flashes back into their brain, they know what to say and what to do, and they move on with their life. So religious belief could help some people not to stay on as PTSD, but sometimes some other forms of belief could allow them to brood more and more, meditate more and more, because some religious beliefs will tell you you have to meditate. Meditate on everything around you. And culture. There was a case of some people that I have known of that while in labor, they don't yell, they don't cry, even with waxing and waning, uterine, painful contractions. Why? Culturally, they don't. And in some cultures, they believe that men don't cry, men don't wail. So, in people like that, the way they're going to handle painful or traumatic events will likely be different based on culture. Idiosyncrasy. Why? This is a unique or peculiar way of thought and reaction to events that is peculiar to an individual. And it could go to the negative side, that the person will become eccentric. So what will make some people to have PTSD, some other people won't, because of the way they take issues in life. So I can give an example here and then I will end this presentation. There is a family that I knew of very well that they wouldn't tell their mom if they'll be traveling home. Why that? The mom will be half dead before they will reach home, because she will be calling every 10 or 20 minutes to find out where they will be. So they've decided our mom will die of panic attack, high blood pressure or heart attack before reaching home, so they won't even tell her we are driving home. So imagine, but some will say, don't tell mom yet or don't tell dad yet. It depends on who could, be a certain story, certain news. And with that, I've come to the end of this short presentation on associated risk factors when it comes to PTSD. Thanks for listening. Remember once again that if you want to listen to full info on PTSD, kindly click on the link that I provided earlier. I appreciate it. Thank you. Subtypes of PTSD. I know many people want me to go to dissociative subtypes right away, but before then, there are certain things that must be put in order. First of all, we have to rule out acute stress disorder and other conditions. That is the first thing to do. So we must be sure this is not within the window when acute stress disorder only could be the diagnosis. So it's not within the 1 to 30 of the post-trauma event. No, it must be greater than 30 days after the exposure to the traumatic condition. And then you must rule out substance use, okay? And then no medical condition or conditions is responsible for this, and no medications is responsible. At the same time, other psychiatric disorders that could mimic this must be ruled out. Then when we are done with that, we can then go to PTSD clusters. In this case, anyone with PTSD will have those 4 symptoms of avoidance, intrusion, mood changes, and arousal. That is normal with people with PTSD, but not everyone will experience the 4 core symptoms at the same time. One will be expressed more than the other, but that's okay for people with PTSD, okay? Then there is an entity known as PTSD with delayed expression. Remember, from the definition of acute stress disorder, past 30 days must be the case before we start thinking about PTSD. And so many authorities will put diagnosis of PTSD as 1 to 3 months post exposure to the traumatic event. But the delay expression PTSD can take as long as greater than 6 months before they will be manifesting the signs and symptoms of PTSD. So that is a possibility. Then with the delay expression also, most people will develop the symptoms in few months after trauma, but a particular percentage, that is 1/4 of people with PTSD will have this, diagnosis known as delay expression, because they'll be presenting with the symptoms after 6 months. So it's delayed. Now, the one you've been expecting, the dissociative subtype. The dissociative subtype PTSD is such that it has higher level of impairment and is also associated with comorbidity. And here we'll be burdened with increased rates of suicide. Specific symptoms here are such that there will be depersonalization, meaning the individual is disconnected with their own body, or they are lost or dazed completely. So the feeling is that the person will feel that his or her body is no longer his or hers. Then they can be down with derealization, meaning the whole surrounding, the entire world surrounding them is not even real to them. Then what is the world? The world is just like they're watching a movie, or they're in trance, or they're just dreaming. So the world is not real. Dissociative amnesia is a possibility here. And they can have dissociative reactions like flashbacks. So that's a subtype of PTSD. You are welcome to my channel. Thanks for visiting. If you have subscribed, I'm saying a big thank you. If you haven't, please kindly remember to subscribe to my channel. Today is about post-traumatic stress disorder. And I will not waste your time. I'll go straight to possible triggers only. Without further ado, let's go. Now, the triggers are those events or situations that could lead to post-traumatic stress disorder. I will start with occupation. Though, in so many textbooks or literature, occupation is not the first factor to be considered. I have decided to bring out occupation because many people will likely ignore, very many people working in these fields that I'm about to go into, and they will not pay attention to them as it ought to be. First on the list will be military personnel. You all agree with me, particularly the compass. Then police officers. Police officers, most of them pass through post-traumatic stress disorder just like military personnel, military officers. Okay? Firefighters, don't ignore them. Some of them will not be able to sleep, when they are back at home because of the experience on the field. Emergency medical service, personnel. Those driving the ambulance, they've seen a lot of accidents, they've seen a lot of traumatic cases that could tilt them to PTSD. Hospital staff. No, it could range from nurses to doctors to radiologists, lab technicians, those working anyone involved in handling patients in one level or the other, even those looking after the corpse, the pathologists, and a lot. It depends on how individual could process what he or she has seen. Also, forensic experts, medical examiners. Some of them will tell you the truth that in my career of so many years, I've never seen anything like this. When you hear that, then ask them further. Do you have PTSD? Lawyers, courts, staff, jurors. Because they've seen maybe murder cases, some horrible cases, they are taken to the scene of the event. They are being shown so many exhibits. They've seen all sorts of things that are too difficult to even depict right here. And investigators of crime scenes, ask them if they have PTSD. Some may have acute stress disorder, but may not get out of it, and it could become PTSD. Even journalists, horrible events have occurred, war front, fire accident, natural disaster, flood, and name it. Even criminal cases, and journalists are covering that. As a matter of fact, they will tell you, if you have kids at home, this is too difficult for some people to do, and so on and so forth. In fact, so movies will be rated. You understand all this kind of stuff? Ask some of these people. They may have PTSD. So we cannot be judgmental when it comes to all these different people that are doing their normal work. When it comes to PTSD, they may be suffering. They may have it. But who will believe them? I do. Then, the topmost on the list will be sexual-related, trauma, rape, violent sexual assault, particularly happening to children, teenagers, and they will grow with that trauma for the rest of their lives. PTSD is common among those who suffer in the hands of their loved ones or even the intimate partner. So, in intimate partner violence, the victim may live with another memory for life, giving her mostly PTSD, but in few cases, him, the male partner, PTSD. Child abuse. That's why it is horrible. Sexual abuse, emotional abuse, physical abuse, and the child may not outgrow it again. War. We are all familiar with this. I will not waste your time on this. Anyone who had lived in a region that is known to be violent or who had experienced war, amongst the refugee people who had lived in refugee camps, how they escape from war-torn cities or countries is very difficult to take it off their brain. All the processes involved in storing this type of info, and it is being played back to them as if it's still happening, even when in the real life nothing like that is happening, has been fully addressed in my PTSD A to Z, the link I earlier provided. Please, you can click on that. I don't want to waste your time here, but we all understand war could lead to PTSD in many people. Natural disaster. The other time I alluded to the fact that there could be flooding, earthquake, volcano eruption, name it. Tornado, just anything, avalanche, anything could happen naturally. Those who are not just watching on TV, not reading on the newspaper, but have no first-hand encounter may not get out of that in their memory. So they will first of all have acute stress disorder. Many will not get out of that phase. They will progress to post-traumatic stress disorder. How about road traffic accident or moving vehicle accident or any accident of any sort that is so remarkable, memorable, that is not getting out of the brain anymore? It could be the source of PTSD. Terrorism. Someone has witnessed mass shooting. There was one we all saw in the world in 2001, and many were far away from New York, but can still remember what they saw on the television. Now, how will you address those who were right there that day? So, many mass shootings everywhere, in school, mall, everywhere. Those who are directly involved may never get out of that memory ever. So they can come down with PTSD. Abduction or kidnapping. We've seen so many cases on television of ladies being kidnapped, being kept for 10 years, for many years. Do you think they can ever get out of it? I doubt it. So many of them might have PTSD for life. Displaced people from their home might be because of war or natural disaster. They come down with PTSD and might be difficult to get out. Seeing a loved one die. Oh boy, how can you wipe that out of memory? It's pretty difficult. Or seeing a dead body. I remember my first day in anatomy lab, our female, colleagues, rush into the lab, but we've never seen dead body being laid on table before, and we needed to work upon. They rush back out, crying. And not that the boys were strong, no, but the expression was different. Internally, we're just processing what we're saying, while some were crying out so loudly, some were just processing it internally and quietly. So that memory can remain in some people for life, but in our own case, we're flooded with it because the second day we were there again, second week, second month, and for the rest of our lives, we've been dealing with that. But to some who will see a dead body once may never get out of it again, and they'll come down with PTSD. Witnessing a crime or being told about news can trigger PTSD. Medical illness. How could medical illness be the source of post-traumatic stress disorder? It depends on the type of illness, like stroke, myocardial infarction, obstructive sleep apnea, chronic pain, or staying in the hospital for a long time could trigger PTSD. And any unpleasant or terrifying or horrific events could trigger post-traumatic stress disorder. Like I said, this presentation is not meant to define PTSD, ASD, signs and symptoms, treatment, diagnosis, risk factors, who could get out of it, who cannot get out of it, the prognosis, and so on. No. This is just to take you through the possible triggers. If you want to know all other facts on PTSD, click on the link I provided earlier. Thanks for listening. Remember to always check my channel, and you are free to leave a comment. I appreciate it. Thank you. You are welcome to my channel. Thanks for visiting. Please kindly remember to subscribe. Right now, I'll be addressing post-traumatic stress disorder, but I'll be limiting myself to signs and symptoms only. Without further ado, let's go. Now, let me start with what is very horrible when it comes to post-traumatic stress disorder. It's happening in kids. Yes, particularly those that have been sexually abused. And what will be the signs here? They will develop fear, sadness, self-isolation, decreased self-esteem. They can become more aggressive in life, and they can know more about sexual behavioral displays. And then they can be hurting themselves and hurt others. Some of them may turn into alcohol use or drug use as young as 12, 15, 18, thereabout. If the child is less than 6 years, you are going to pick some different but well-defined signs and symptoms, like retrograde bedwetting. The child who has not been bedwetting before is now bedwetting. Not speaking, a child who could speak at a particular place, and at a time, for example, she talks at school, she plays with her friends at daycare, but on getting home, she's quiet, she's silent. Something has gone behind you. Find out. Acting out the traumatic event in play, like kids are just playing at the park or just a group play, and the child is acting out exactly what has happened to him or her. Take it serious. clingy with an adult because he or she has been abused or traumatized. So seeing an adult around is like, oh, this is going to be my Messiah who is going to save me from this trouble. So when they see somebody they could cling onto, they will do that firmly. Expression in school and journal and story. So when they have assignment given at school, read that very carefully. That might be the only opportunity to know that something has gone wrong, and the child will express him or herself in journals and in stories at school. If the child is greater than 8 years, he can have flashbacks and other symptoms as could be found in adults. The teenagers will, anyone greater than 12 to 18 years can have destructive, actions. They could become disrespectful and even impulsive. Some will be so aggressive. Don't blame them, just find out what has gone wrong. Okay? And some will be revengeful, like if they are being abused sexually by their father or stepfather, they may go after his life. Some will feel guilty for not preventing the accident, and so on. The components of PTSD will include the basic factor that must be present, and that will be the history of trauma. The history of trauma here could be very real or just being perceived, but it will be scary, terrifying, or life-threatening. Okay? Sometimes might not be, but majority of the cases will involve trauma that is real or perceived, but will be scary, terrifying, or life-threatening. I will not pretend that this is going to be the way it's going to be with everyone. Sometimes it may not be, but the timing is the issue. Well, that I will explain further, but let me quickly touch on that right now. The immediate hours, days, or weeks up to 1 month after the traumatic event or events, the reaction that time is tagged acute stress disorder. Okay? But when it is persistent beyond that, many people will have that, but after that, majority will get out of it. When it is persistent beyond 30 days, then we are into another territory, which is PTSD. Here, the brain is like playing the video recording of the event. So it is vivid. We'll touch more about that later. And the individual will tell you one thing that is very common to everybody. I can't get, I can't get it off my brain. And that is the truth. And that is why it is a problem. That is why I'm making this presentation. There are symptoms that have been grouped together, 4 of them. Some tag it as clusters. And that will include intrusion. Don't worry, I will delve into that in a bit. Avoidance, mood changes, and arousal. Now, the intrusion. Intrusion is the distinguishing feature of post-traumatic stress disorder. Here, the individual will talk about nightmare, particularly in children. But when an adult comes down with nightmare, then just market, the history of trauma in him or her, and the timing of the history of trauma and the symptom that we are dealing with right now will tell us whether we are dealing with acute stress disorder or PTSD. Then they will be having flashback on how the event happened. And that will still be going on at the moment that the individual is before the physician. They will have clear picture playing itself in their brain. The individual will be overcome with fear and apprehension. They just don't want to go near it anymore. They do not mean. It's just happening and repeating itself in their brain. Then the next group of symptoms will be avoidance. What's happening here? From the straightforward word here, it is pretty clear. Once bitten, twice shy. Why? They'll be running away from all appearances of a similar event. Let me give an example. Someone is involved in road traffic accident, and then he or she says, I'm not going to board vehicle again, but how will you get back home? How will you get to the hospital? Even when you call 911, EMS people are here, they're still going to take you through either a helicopter or the vehicle to the hospital, even for treatment. But you might be struggling with them. If they are capable of talking to you, you might be struggling with them to even put them in. And that is acute stress disorder, right? Now, months and months and even years after, because they've been involved in road traffic accident, some of them, if they have another means of transporting themselves, might go through the air or the sea. But they will reluctantly go through the same road if they must. Anyways, that's an example I could give. They will do everything to avoid it. Then they don't want to talk about it anymore. You would have heard people say, no, don't say that to me anymore. Don't remind me of that anymore. Then they will not want to see that particular place or person any longer. And they will not be visiting this place where the event has occurred. Some will visit New York Ground Zero for 911, September 11, 2001. But majority would like to avoid that. Not entering a particular room or house where the event has occurred. In fact, in the Western world, when a house has been involved in a very serious crime, the authority will pull it down completely. Specific phobias will be developed, and then some will even change address, all to avoid a repeat occurrence. Arousal. Here they will be hyper vigilant. They'll be on guard or they'll be on the lookout. Here they might be unable to sleep. They can't sleep. Or they have altered sleeping pattern because they are watchful. Okay? The anger in them might rise. They could become irritable and anxiety may be on the increase. They can do something that is odd, that is labeling people as being dangerous or wicked. And then they perceive normal events as no-go area because of the experience that they've had. Now, mood changes. Of course, the mood of anyone with PTSD will change. And that could be tilting them to anxiety, specifically generalized anxiety. Some will have panic attack, and some will go into depression. Depression here will involve mood changes, sleep alteration that could be either increase or decrease. They could become inattentive and then be feeling guilty. The energy level will drop and they will have poor concentration. They will no longer have interest in what is interesting or pleasurable to them before, will no longer become pleasurable to them. For example, going with their friends to camp and so on. Then psychomotor retardation, and the worst part of it, they could go into severe depression and lead to suicide. When it comes to substance use, like alcohol, street drugs, it will be on the increase. They can come down with specific phobias, depending on what they've experienced before. Some, agoraphobia, phobia of any sort, that they will be afraid of the exact, picture or domain where the event has occurred. Physical symptoms here will present like panic attack. There may be history of sweating, tremor, dizziness, headache, chest pain, body pain, tiredness, decreased energy level, and even decreased immunity. There may be medical diseases that will be associated with this. In that case, they may be battling with cardiovascular disease, neurological problems, respiratory disorders, metabolic derangement, autoimmune diseases will be on the increase. They will become patients of irritable bowel syndrome. I'm not saying all these will occur in one person with PTSD, but it's very likely. I mean, one of these diseases can then surface with PTSD, yeah. Then if they are known to have migraine, oh boy, it's likely going to be on the increase. I mean, they will be having more attacks of migraine. And history of heart-related diseases might jump, and they can even have heart attack. There is a dissociative subtype. And the reason why I want to mention that right here is that in this type of PTSD, the sufferers will have higher level of impairment. And it's likely going to be associated with another disease entirely, so comorbidity. Here, the suicide will be on the increase, and then they'll be done with specific symptoms like depersonalization. In depersonalization, they'll be like lost completely or dazed. They are disconnected with their own body, and then they will tell themselves or anybody around them that their body is no longer theirs. It's that bad. And then they can be done with derealization, meaning the whole surrounding, the entire world is not real, but they are just in a trance or they are just dreaming. They can have dissociative amnesia. Yeah, it may be present, and they can have dissociative flashbacks. Then PTSD cluster. PTSD clusters, like I've alluded to earlier, is the combination of the four symptoms. So the cluster might be happening in all PTSD patients, but not everyone will express each component in the same pattern. Okay, some will have more intrusion than avoidance. Some will have avoidance than arousal, or mood changes will be more prominent than the other. So most PTSD patients will have the four symptoms, but some will be more prominent than the other. Then externalization. When they are externalizing, they will have aggressiveness, impulsivity, increased alcohol use, increased street drugs use, with or without borderline personality disorder. Meaning they are not able to suppress all these reactions. It is showing forth in them. But some will internalize it. In this case, they have mood changes more. And the mood changes here will be towards the negative, depression, then negative emotionality, but they can be down with somatic symptoms that will present like the physical symptoms I stated the other time. The worst thing here is that they are becoming introverts. So introversion is a key feature of internalization when it comes to the PTSD. And that is really scary. Why? They will have the kind of withdrawal to themselves. They are not speaking out. They are not telling anybody what is going on with them. They are cumbered with excessive thoughts and feelings, and they will behave in one way or the other that will be, pointing to PTSD, but they may not even say anything to anybody. Such people can go to profound depression and commit suicide. With that, I've come to the end of the signs and symptoms of PTSD. Everyone needs help. Anyone affected needs help. Please don't keep it to yourself. Speak out. PTSD is a serious condition that must be tackled. It is not your fault. No, it's not your fault. So, contact someone for help. Thanks for listening. Please remember, subscribe to my channel. I appreciate it. You're welcome to PTSD once again. Now, it is about diagnosis alone. Without further ado, let's go. Now, we cannot make the diagnosis fully without signs and symptoms and thorough history, including physical examination. Let's review the signs and symptoms of PTSD. There's a separate presentation on that, or you click on that very link already provided. Then the features in children. Please click on the link provided and we'll get that fully. Adults will have 4 symptoms in group, meaning a cluster. Intrusion, avoidance, arousal, and autoimmune symptoms. So if you watch my channel and you listen to signs and symptoms as per PTSD, you get all this. Or if you go through the link provided as per PTSD A to Z, you get all these files. Setting occupations and list of risk factors already published. The link is right here. Okay, let me bring it down. So the link is there. Who needs screening? First time presentation of certain conditions will lead to screening. So first time presentation of fear, anxiety, insomnia, bedwetting in a child who has outgrown that, or a child who stops speaking in a particular place, like not speaking at home, but could speak at school, could play with his or friends at daycare, we should start now screening for PTSD. An individual with nightmares, particularly adults with nightmares, we should start screening for PTSD. Still on who needs screening. When we are faced with certain known conditions, we will screen for PTSD at the same time. Like anyone with social isolation, living by him or herself, not relating with anyone around, screen for PTSD. Someone had been taking alcohol before, maybe a bottle, in 2 days, a bottle in a week, and suddenly it has jumped up, significantly or geometrically, start screening for PTSD. Somebody is already using drug before or not using it at all, but now starts using drugs or using it more than before, then we will screen for PTSD. And some other individuals are working, in a particular establishment, and suddenly they are taking more overtime or staying at work, or they even tell the boss, don't care about paying me for overtime. I enjoy staying here and working till late hours. Why that? They are trying to avoid something at home. So they are whiling away the time. We should screen for PTSD. Also, everyone exposed to a traumatic condition or conditions now presenting with likely cause symptoms after 1 to 3 months, the individual must have gone past acute stress disorder, but intrusion, avoidance, arousal, and mood changes are now presenting. We must screen for PTSD. The tools for PTSD screening will be the following, but not limited to these, and that will be primary care PTSD scale. You can look for that anywhere you are practicing. Then PTSD checklist 5, and then clinician administered PTSD scale. Now, to make a definitive diagnosis, we need DSM-5, and that is Diagnostic and Statistical Manual for Mental Health, 5th edition, specifically written as Diagnostic and Statistical Manual of Mental Disorders, 5th edition, will be the one to use. And in that case, it is going to cover a lot of things like the real traumatic event that is so life-threatening or with serious injury, could be sexual attack or anything related to that. Then is this individual directly involved or witnessing it or investigating it or learned about it or is affecting loved one and everything like that? Then they'll begin to look for the symptoms that will form the cluster when it comes to PTSD: intrusion, avoidance, arousal, mood changes. Is it affecting the lifestyle of the person entirely, occupation, interpersonal relationship, and everything will be dealt with. So many things is in this DSM. So the best thing to do is just to go for the DSM and then look out for the facts under that. I bet all these symptoms must be greater than 1 month. Okay, when it is greater than 1 month, then you are likely dealing with PTSD. Do you know why that? First day to 30 days after the exposure to the unpleasant event is still under acute stress disorder. And the individual that will be diagnosed definitively with PTSD under DSM-5 must be greater than 6 years. Now, to make a definitive diagnosis, we must be careful. There must be no street drug use here. And we must rule out any possible medications that could be involved, either a single meds or many. We must make sure that we have ruled out all other medical illnesses, and there's no other psychiatric condition or conditions that could be the diagnosis. Still on making the definitive diagnosis of PTSD, let's check what is happening in this individual. any positive history of trauma? Is this person directly involved? He or she may not be directly involved. It could be as a result of occupation. EMS, police officers, forensic experts, medical examiners, court clerks, even lawyers arguing the cases and going through a lot of exhibits and crime scene investigators, and the list goes on like that, could have just witnessed it. Yeah, someone saw a woman, in the pool at the backyard, just a staff who came around to walk in the house and saw that and felt that this woman is no longer breathing and calls police. He or she may not get, and the man may not get out of that again for the rest of his life. Or even if it's a female, the same way. Or this is happening to a close person around. It's not happening to you, it is happening to someone pretty close. That could tilt you to PTSD today. Or you are not really involved, but you have full knowledge of what happened. Like when I was going through the list of occupation that will lead to this, because most of the times when we talk about PTSD, so many people limit themselves to the military personnel only. No, there are a lot of people involved in, even lab technicians in the hospitals who have to take samples, or radiological technicians who will do the x-ray of somebody that has passed through trauma and so on and so forth. You can tell what will trigger PTSD in anyone. Remember idiosyncrasy, right? Go through the list of risk factors already published by me. Close call events, like it has not happened but almost happening, like near accident or near death, and the memory is flashing back in the brain, or there was a serious damage, or the individual could have died. So, or could constitute conditions that could lead to PTSD. Yeah, the timing. When we want to make definitive diagnosis of PTSD, the symptoms could be present, the history of the trauma could be there, the patient is right here, but the timing will tell us whether it is acute stress disorder or PTSD. Acute stress disorder is all the symptoms occurring the day of the exposure to the traumatic event up to 30 days. That is acute stress disorder. So many people will get out of this, many people will experience this, but they will not come down with PTSD. However, many of our loved ones, sometimes ourselves, will be having those symptoms persistently beyond the first month, and that is PTSD. So PTSD is diagnosed when those signs and symptoms are persistent more than 1 month, and some will put it as for 1 to 3 months, okay? But there is an entity known as delayed PTSD. Here, the onset is not within the time frame stipulated earlier. It's not within 1 to 3 months post-trauma. It's going to occur in greater than 6 months post-trauma. That is delayed PTSD. Most people would develop signs and symptoms in a few months after the trauma. 25% or a quarter will have the delayed onset of symptoms that is greater than 6 months. Then there's another entity known as complex PTSD. Here, it is associated with repeated events and will have dissociation. The perception of self will be negative, and there is negative self-image. This is not good. Nothing is good here anyways, but people with this may be tilted to more depression and possible suicide. Still on definitive diagnosis, we've taken the history, we've picked the symptoms, the time has been fully defined. Now it's now PTSD query, but something significant must be part of the history. There must be disturbance in lifestyle, one way or the other, either in activities of daily living or instrumental activities of daily living. So the individual is being affected as per occupation, marriage, interpersonal relationship, not willing to go out anymore, not willing to do many things anymore, sleep pattern is being altered, and the list goes on. So intrusion symptoms are already here. I will not waste your time going back, the flashback and everything. Check my channel for that. I have full info already published on there. Avoidance and mood changes. Please kindly click on signs and symptoms of PTSD right here, or that long presentation through the link already provided. You'll get full info about that. Arousal or hypervigilance. Please check the same link. You're going to find full info. Is it with dissociative symptoms? Please remember to click on the link provided for PTSD A to Z. Is it associated with delayed expression? The link to PTSD A to Z will also help. Now, lastly, PTSD is likely going to be associated with borderline personality disorder and antisocial personality disorder. With that, I've come to the end of this presentation as per the diagnosis of PTSD. Thanks for listening. Please continue to listen to presentations on my channel, and you're free to leave your comment. I appreciate it. Thanks for visiting. Let me go straight to PTSD treatment. Referral should be considered as early as possible. To who? To a psychiatrist, please. Is it curable? No. But some will get out of it within the first 1 year, some within the first 10 years, and some it will be chronic for a long time. But there's no cure. Who needs treatment? Anyone who is no longer in the phase of acute stress disorder will need treatment as PTSD affected individual. And let me explain here. ASD is acute stress disorder when we are subjected to a traumatic situation. We will have some signs and symptoms. But that is expected to last day 1 to 30. Once it is greater than a month, you are still having signs and symptoms triggered by the exposure to the traumatic event or events, then it's no longer acute stress disorder. It has become something else, and that is PTSD. Then we will also look for effects, complications, affecting occupation, marriage, or relationship. Is that the case? This individual needs treatment right now. Is it affecting activities of daily living or instrumental activities of daily living? You can no longer cater for yourself. You are so down as per the mood changes, depression. You need treatment right now. Still on who needs treatment, you are preoccupied with the thoughts and the feelings and the symptoms of this condition. Then you need treatment right now. You can no longer sleep normally. Your sleep pattern has been altered. Maybe you're not getting to sleep, or you sleep, you're not getting enough, you're not refreshed, it's been disturbed one way or the other, you need treatment. Physical symptoms, sweating, headache, pains, name it. You need treatment right now. Mood changes is already here. We are now having more and more, consciousness and awareness and anxiety, depression, and you're even becoming suicidal. In fact, must be admitted with suicidal ideation, suicidal thoughts. Be admitted and put under close observation. So, the treatment will start with counseling. The history is already there. The diagnosis is already being made. Then the counselor will come in who will take care of that aspect based on the appropriate need of that particular individual. There could be distraction. It's a way of taking your mind off the video that is being replayed and continuously in your brain. Now, psychotherapy will be embarked upon. There is an entity known as child-parent psychotherapy for pediatric age group, and also exposure therapy, cognitive behavioral therapy, and then cognitive processing therapy, or some call it cognitive processing psychotherapy. So, all these could be, made use of depending on the specific need of the individual and the direction that the psychotherapy will go. Physical exercise will help with relaxation and breathing. And now medications. The reason why I'm putting medications last is we should do what we can do without making use of medications, because there's no medication we are going to give that will not have side effects. But one group should not be used in PTSD patients, that is benzodiazepines. We should avoid it as much as we can. Antidepressants will likely be the call here. So we'll start antidepressant with selective serotonin reuptake inhibitor like sertraline, paroxetine, or fluoxetine. Then norepinephrine, serotonin reuptake inhibitor like viloxazine could be tried. Insomnia could be handled with trazodone or prazosin for children, but watch the blood pressure, please. Other medications include clonidine, but please watch the blood pressure. Tricyclic antidepressant, but watch the anticholinergic effect and the horrible effect on the heart like arrhythmia. Monoamine oxidase inhibitor, please watch out for tyramine containing compound, food-related, or other medications that must not be used concomitantly with monoamine oxidase inhibitor, because many other medications will have to be taken off when the individual is on monoamine oxidase inhibitors, or at least 2 weeks will occur between the stoppage of monoamine oxidase inhibitor and the onset of a particular new medication. Find out from your pharmacist or from a clinical pharmacologist while making that determination. Mirtazapine is also helpful, and beta blockers, particularly in acute phase, will be helpful. But watch the BP, please. If you are dealing with refractory cases, you've used the antidepressant, you're not winning, then ketamine, riluzole, then some will use cannabis or synthetic cannabinoids, Nabilon. And of course, you still have the room there refer. I started with referral, I'm going to end with refer. As a family physician handling this, you can be monitoring and make the definitive diagnosis, but if you refer early, it will help the patient more. What are the advantages of treatment? If someone has PTSD, why should a person seek help at all? It's going to improve your lifestyle, for sure. You'll be better off, okay, than the individual who will keep it under the table and they won't even discuss it with anyone. It's going to serve as impetus for others to seek help. When two people are exposed to the same traumatic events and they are not coming out of it in the first 30 days, they are both now PTSD patients, then one is seeking help, the other one is not seeking help. If the one seeking help is seen as improving, getting out of the trouble, now back with his wife or her husband or whatever the case may be, or getting back to job and life is getting better, playing with his or her children and so on, then the other one who is not seeking help might want to seek help now. Yeah. And this is pretty important. This is the reason why many people die. They don't want to seek help. The society will judge them. The stigma. No, nobody will believe them. Now, like, how will many people believe lab technician to be having PTSD or case of sexual assault when the story is not even believed in the first place? How would they believe that she's not having PTSD? So all these things could lead to untimely death. And of course, it's going to decrease suicide. Like when you seek help, they will know, the level of the depression. Then maybe you need immediate or urgent attention, including admission to, to the hospital to be probably monitored when you have suicidal ideation, suicidal thoughts, or attempted suicide. All those things will help in making determination and decrease the rate of suicide, because many with PTSD will end up committing suicide. With that, I've come to the end of this short presentation as per the treatment of PTSD. We can appropriate all these things and the sufferers can now have improved lifestyle. Thanks for listening. Please remember to subscribe. I appreciate that. Let me quickly address some stuff in form of warnings for me and everyone. Most times people commit suicide with PTSD, and why that? When they are overwhelmed, either because they do not have treatment and the symptoms will keep on disturbing their lives, or they are receiving treatment but it's inadequate, it's not adequate, or the treatment is not even appropriate. That's why I said under old age treatment that you have to refer as quickly as possible. Not correctly diagnosed, please let the psychiatrist know about what you are dealing with. Affected person is not believed. This is the key. This is the major issue. Don't hide your problems to yourself. No, just speak, tell someone. Tell someone you can trust. If you are not being believed, just go and meet your doctor. If it doesn't believe you, go to another one. Okay? Don't keep this to yourself. Some people end it all when they don't have social support. But when you contact your physician, they will guide you with social welfare. Lack of social ability to deal with daily life events can paralyze many people, and then they end it all. Social stigma is another issue that will keep some people off. If there's any way that the government can be involved and some non-governmental organizations could help or lend a hand to the government establish, centers to let the society be fully educated that you didn't create the trauma that you were exposed or subjected to. No. Now, something that happened inadvertently and is disturbing your life should not be kept to yourself. No. Some are being forced to continue within the care because they have no opportunity to seek another and they are not getting a good one. No, we should watch out for that. Then we must see that depression has been fully addressed because mostly depression will lead to suicidal thoughts, suicidal ideation, attempted suicide, and frank suicide. Well, some can be wrongly diagnosed as PTSD, whereas what is happening to them is just because they are having repeated encounter with stressful events. Let me give you a particular scenario. A doctor can take history today and say, okay, this encounter is your first exposure, so this is acute stress disorder. Okay? And the patient walks away. Then 3 months or 4 months after, the same patient is presenting with cluster of symptoms of PTSD, but because of another issue entirely. Then the physician will say, oh, okay, you were here 4 months ago, you are here today, but the patient presenting today is presenting today not because of the events that happened 4 months ago. The event that happened 4 months ago was maybe road traffic accident. Today, the patient is presenting because of divorce paper already being served yesterday. So there is no correlation, right? So like somebody has been sexually assaulted in January and in April is now having road traffic accident. So we should manage that, and then maybe 3 months after the person is having earthquake. So we should take thorough history to help us appropriately. The prognosis is such that there is no cure, but 1/3 can recover in 1 year, 1/3 at 10th year. I did not see any literature where it has been written that 1/3 will remain the same, but I figure it out. Simple arithmetic, right? We have 3 1/3 to make it whole number. So if 1/3 recover in 1 year, 1/3 in 10th year, then what's happening? There should be another 1/3, right? And what will be happening? Remain the same. So you can leave a comment here. Now, in conclusion, about this long and interesting, that should be helpful, a topic known as PTSD, I would say the story from A to Z right now is all around awareness. We are educating people to know that PTSD is real and there should be no social stigma attached to it. It's not your fault. You need that help, so seek help, please. It's not your fault that I'm repeating it. It's not your fault. So seek help. With that, I've come to the end of this long presentation as per PTSD, but it is a necessary one. It's my hope that this will trigger action from your end to help yourself and help your friends. Thanks for listening. Remember to share this on your platform. I appreciate it.